All right, thanks everybody. I really appreciate you doing this way. Good morning. Again, my name is State Representative Mark Batnick. I'm from the 97th District. We're based out of Plainfield and surrounding areas. As we get closer to the April 30th deadline of the stay-at-home order, and we anticipate that the governor will be extending the order further, we wanted to highlight some changes that can be made to make this stay-at-home order both healthier and more reasonable for all of Illinois. Now, I want to be very clear. We all understand the need for the stay-at-home order and know that there's seriousness to COVID-19. And a little side thing here, the governor talked about a May peak, and he had previously talked about an April peak. What we're really looking at is a long-term plateau. We can't look at the peak in terms of a day as much as it's going to be a period of days and weeks. If you look at the hospitalization data, that's what you see. And one of the disappointments to me is the fact that in my area, the hospital numbers are actually still going in the wrong direction the last couple of days and are kind of at the worst shape. So we're certainly in tune with what's happening on the ground. Last week, you guys know I wrote a letter that offered a handful of suggestions that I've experienced firsthand in my community to kind of help, hopefully, bring those things down. First of all, seniors who are at high risk should continue to stay isolated and utilize programs like my Helping Home program that I started in my district. This will help them stay at home and away from exposure to the virus. We've literally reached hundreds of seniors in my districts, kind of twofold. We're doing things where we're helping people one-on-one, but then we're also providing volunteers for services like Meals on Wheels or the Oswego Senior Center or mobile food pantries and whatnot. We feel it's actually better to do more to keep seniors isolated as opposed to have them out in the stores. Programs like this can certainly be expanded on a statewide level with volunteers and would greatly reduce the risk to one of our most vulnerable populations. It should also become a requirement for all employees to wear face coverings inside stores and restaurants. I know you've seen that I've really pushed this out. And at the end of my section, we're going to show you guys a picture of a poster that we're having stores who voluntarily do this put in their windows. Exposing large group of people in closed settings is dangerous, and we need to do more to protect those people. In his press conference yesterday, the governor said that changes to the stay-at-home order were coming. It is our job as policymakers to take in all the evidence and make a collaborative decision that is best for all constituents. And we know that there's not easy answers as the situation seems to change daily, but a common sense approach to rebalancing restrictions is the best step forward. And I'll kind of leave it with this. The more we show common sense from the government, the more there's going to be buy-in from the public. And if we don't get the buy-in from the public because we can't police everybody, I think we're going to be in much better shape long term. With that, I'm going to turn it over to Tony McCombie, and I'm also going to ask Ryan to put up the picture. Thank you.
Okay, do I get started now? All right. We're all kind of learning this here as we go. So good morning. I'm Tony McCombie, State Representative for the 71st District here in Northwest Illinois. Today I'm going to talk about Illinois hospitals and our healthcare workers. But maybe not in a way that you might be thinking. They've been especially hard because of COVID-19 pandemic. While our healthcare workers are the frontline workers fighting against the virus and treating those that have tested positive, many hospitals are losing huge resources, which put the jobs of our healthcare workers and the financial stability of our hospitals at risk. To prepare for a surge of potential positive cases, our hospitals were forced to cancel elective surgeries, both inpatient and outpatient procedures, and have seen fewer doctor and ER visits from would-be patients. Some hospitals have worked to open up availability of beds, of ICUs to prepare for the unknown. Even as the number of positive cases requiring hospitalization has remained fairly stable in some areas. We're hoping that the governor announces support for our healthcare organization and allows for them to slowly return to normal operations as soon as and as safely as possible. We need to allow for our hospitals that have a plan, who are not overburdened, who have sufficient PPE, which we hear a lot about, and who have the ability to test and protect their staff and the patients who need to schedule procedures that have been canceled or indefinitely postponed. During these times, we have not been talking about the healthcare workers who are not working. They want to return to work and give their communities the medical services that they need. We don't know yet the public health ramifications of what this pandemic has caused by any means. We have a broader section of the population across the state that are suffering from other conditions such as diabetes, cancer, high blood pressure, heart and kidney diseases. And they are delaying standard and necessary care, which could lead to bigger issues for that population. People are afraid to go to the hospital, and when possibly they're having heart attacks or emergencies, they're not going, and they shouldn't be afraid. They need to go and seek care. We must stop what is turning into a possible additional healthcare crisis and protect every citizen, especially those that we talk about are in fragile health conditions. This is a growing concern that life-saving cancer preventative screening services like mammograms, MRIs, colonoscopies are significantly being delayed. Just this week on Friday, as a matter of fact, mine is canceled, and I know Representative Batnick and other members have had standard procedures that we just don't even know when we're going to be able to reschedule those. More importantly, this all translates into a loss of critical services and care with an unintended consequence of a loss of revenue, not only for our healthcare organizations, but also for the healthcare workers and their families. And this is especially concerning for parts of the state where the outbreak has not been as severe or those hospitals have stabilized. As the governor revisits his stay-at-home order and develops any new public orders, we ask him to work with the professional organizations to develop and recommend guidelines to permit our hospitals to care for us all, establish a safe timeline to return to more normal operations, and give them the tools to prepare for any spread of the virus. In many of our districts, rural critical access hospital like Morrison here, Community Hospital, or general acute care hospitals like CGH and Sterling are huge pieces of our economy and are our largest employers, but most importantly are fighting to provide our families with medical access, which is a huge concern in a lot of parts of our state. We're hearing from hospitals who do want to return to their normal operation, but in phases, starting next month, and that could possibly look like starting at 25% of their normal volume and returning to normal full-time operations as time safely permits. They want to provide medical services to our communities, and they believe they have enough PPE to do so safely at the current levels of positive cases locally. Like Representative Batnick said, in some cases that's not the case, but our facilities are certainly not going to open up for inpatient and outpatient services when it's not safe for them to do so. Let me be clear. We're not saying that hospitals and healthcare facilities should resume, all of them should resume normal operations on May 1st. But let's empower them, the professionals who best understand their workforce capacity, their PPE supplies, and the ability to manage this transition to decide the safest and best outcome for our communities. And now I'm going to zoom on over to Representative Ryan Spain from Peoria.
Well, thank you very much, Representative McComey, and thank you all for joining us here today. We know that since the stay-at-home order went into effect on March 21st, we've certainly seen sacrifices taking place all throughout the state of Illinois. And those sacrifices have been showing very beneficial results. We've undoubtedly saved lives throughout the state of Illinois. We've slowed the spread of COVID-19. We've bent the curve, allowing our healthcare workers to be more safe and better able to do their jobs. And so this has been important work, and we've all made sacrifices together, and we'll continue to do so because this is going to be a long process for us as we go forward. But now we are looking at how we go forward and how we think about economic recovery in the state of Illinois. And so you've heard Representative Batnick talk about the important work for protecting employees and customers and wearing masks and using data to guide our way. Representative McCombie has talked about hospitals and the resumption of important, critical, essential healthcare services that may not be COVID-19 related, but are absolutely essential to maintaining community health and population wellness throughout the state of Illinois. And I want to talk about the business recovery. And I certainly thank Governor Pritzker for his leadership during a time of crisis, the guidance that he has offered to the state. But the legislature is also interested in offering guidance to the executive branch and certainly to the administration, where we see lots of decisions being made. And our guidance is how can we constructively, safely, responsibly resume an economic recovery that really is critical to where we go next as a state of Illinois. The safe opening or reopening of our state economy is the important work that now faces us. And we believe that there should be allowances made for businesses to reopen as long as they can do so safely. So that's social distancing requirements, use of masks, use of density controls for the particular businesses. And as we've seen, and we've certainly all heard as legislators from our constituents, there is tremendous confusion about what businesses are essential versus non-essential. And we have numerous examples of items that you could purchase, for example, at a big box retail store, which is open and essential, but a small local business, a mom and pop business that may sell some of those very same items, shoes, books, flowers, those businesses are being ordered to remain closed. And so I think we all have personal examples of why this matters a lot to us. And we hear from our constituents. You know, for my family, my father is a small business owner, literally has a sole proprietor retail business on Main Street in Peoria, Illinois. And those are the type of businesses that, if we're being honest, can safely reopen and resume activities. They will not be suffering from the same type of volumes and densities that, quite frankly, we're seeing in some of the larger retail establishments. So there are a number of things that we should be doing. And to just give you an example, this is not an exhaustive list, but think about some of the businesses now that may make sense to reopen here. And I'm going to share my screen, so hopefully this is working. But businesses like art stores, car dealerships, clothing stores, shoe stores, salons and barbershops, there are a number of things that we can begin to do, and we hope the governor will do and incorporate into the revisions to his executive orders to allow businesses as appropriate to be able to resume activities. This will be different for different types of businesses and likely should be different for different parts of our state. In other words, having a regionalized approach as we see other states are doing throughout the country. The last thing, and I want to pull up a specific example, because one thing on the list that I just showed, and I think it illustrates why we need to move forward to a different way of conducting ourselves and responding to businesses in the next wave of executive orders. Consider this example, which is the example of garden centers in our state. And we as legislators receive a tremendous number of phone calls and inquiries from local nurseries, flower shops, garden centers about whether they could continue to conduct their business. And so on March 28th, we received guidance from DCEO that deemed those businesses non-essential. And so in effect, they were ordered to be closed. A couple weeks later, with continuing to push on this issue, DCEO allowed the caveat that these garden centers could maintain their inventory and then process online and phone orders. And then they went further to issue new guidance the following day that said, we'll also apply this same logic to garden centers at big box retail stores. And while that was an effort to level the playing field, what it ended up doing was causing some retailers like Walmart or Home Depot to actually cancel the flower orders that they had purchased from local nurseries in the first place. So the answer here isn't to try and shut down more businesses. It's how do we turn the corner and allow businesses to safely reopen, especially when it's a common sense business like a local nursery that sells flowers for working at your home in the outdoors, where we're all spending a lot more time now. So we believe common sense ways to move forward without picking winners and losers, and that this is an important step as we begin the economic recovery for the entire state of Illinois. So with that said, we have one more speaker, and then we'll open it up to questions. And I just want to turn it over to Representative Dave Severin.
Thank you, Ryan. I appreciate that. And coming from the 117th district down in Southern Illinois, my office is in Marion. And I want to share with you some thoughts that, again, all the things that have been said this morning so far are affecting Southern Illinois, but I want to give another spin to you to consider some other areas. So the governor's decision to close Illinois' state parks, the conservation and the recreation areas, they've had a direct negative effect and impact on Southern Illinois. From the crowding in the suburbs and the cities to the wide open spaces that we have here in the rural areas of Southern Illinois, the state of Illinois is very contrasted in size from the top of the state to the bottom as far as the social distancing right here in my district. So I represent 3 counties in my legislative district. And think about this, it takes 3 counties to make up my 108,000 constituents. We're in the northern part of the state that may be just a few blocks. So since Illinois was the first state in the nation to close our parks, I believe we should be the first to reopen them. And that would provide social distancing, an opportunity for us to do that correctly in our parks, in our outside areas as far as lakes, parks, recreation areas, those types of things. So we have an opportunity to do that if we will follow the guidelines of social distancing, if we'll also make sure that we have the PPE items adequate for our state workers in the areas. We believe that this should be opened back up. So if you think about campsites are a great place to do social distancing because they're remote. Hiking trails, they're remote. Horse and ATV trails, they're definitely a remote. So there's activities that can be enjoyed by Illinoisans while maintaining this social distancing. So I just want to talk again a little more about outdoor activities, how they greatly affect our mental health. And that's one of the most important things dealing with this pandemic at this time. So to how to have a positive impact, it's very important during these trying times that we do this, especially for people that are being quarantined even at home. They can still get outside and enjoy some of these things. So we're not asking the governor to throw the door wide open, but to pay attention to the things that we can do on a soft, open type basis. So we know that the state conservation police, they can be on duty to protect the areas, preserve and make sure that folks follow the social distancing, and also we can keep our parks, trails, lakes, and rivers safe. So we think we can open these parks and monitor them for problems, put up signs, get information out to the people in the public, and allow our citizens to participate in outdoor activities. We believe that opening the state parks and trails with proper social distancing will allow our citizens to participate in outdoor activities. So we think that's going to improve the overall wellness of the Illinoisans from the top of the state to the bottom of the state. And there's no better place to get fresh air, exercise, hunt, fish, and enjoy the outdoors than in our thousands of acres of woods, trails, streams, lakes, right here in the state of Illinois in the state parks.